All right, everybody, welcome to Unscripted from my basement, which will soon be at the junction. I promise. I know I keep promising, but I tell you, I promise it's happening. Thank you, Corby, for my introduction on the audio. I'm going to make a quick introduction, and then I will turn it over to my guest. And I'm stealing this directly from her company's video, which is really, really good. The video is very strong. The topic is tough, but imagine hearing the words, "You have cancer. What do you do next?" 1 out of 2 men and 1 out of 3 women will receive a cancer diagnosis during their lifetime. And I want to pause for just a minute, because if you're hearing that, just think about that statistic for just a second. There's only 2 of us on this interview right now. And think about those numbers again. This is something that probably has affected, will affect. It impacts us all either way. All that to say, my guest today is Anna Buehl. She is the manager of business and development for CancerBridge. Anna, would you, I'm sure there's a lot more there on your bio that I didn't even begin, but I really wanted to set the pace right away for everybody to understand who you work for and why we're having the conversation today. So would you please introduce yourself to my audience?
Absolutely. Thank you, Aaron. And thank you for having me on today. Just an honor and a pleasure to be here. So yes, like Aaron mentioned, I work for a company called CancerBridge, and my current role is the business manager. I'm in charge of all business operations and development. And our overarching goal, of course, is to provide a benefit to those in need. And it's a very broad range of what we do. There's obviously a large oncology focus, primarily oncology, but you know, when somebody hears the word cancer, often it has this negative connotation to it, right? And all we think of is the bad, right? We don't think of, hey, there could be some proactive positive from the wellness space, from the early screenings, from the intervention to early diagnoses. And all of those end up providing a better life, potentially reducing cost. And so what we do is provide that benefit to people. And you know, I'm a nurse, and so I stepped into the oncology space of nursing several years back, and I just really had such a passion for what CancerBridge does and what CancerBridge offers. Personally, you know, I think that not only from a professional perspective and taking care of patients, but also from my own mother had cancer last year. And, you know, the first person she called was me. And not just because I'm her daughter, I'm sure that made like a huge piece of that too, right? But because I'm a nurse. And, you know, a lot of times people don't have that connection. They don't have somebody that they can call and say, what do I do now? I've just received this diagnosis and I don't know where to start. That's what CancerBridge does. And, you know, I had this opportunity and I just had a passion inside my heart and my soul, and just wanted to help as much as I could in our community, and locally, regionally, nationally, however big of a footprint we can get, we will.
That's awesome. And when you and I talked a few weeks ago, and everybody knows, and I say this a lot, but I'm not very bright. So I always try to think of analogies, and the analogy I could come up with, and it's probably not a good one, but when you go out of town and you go to a hotel, you know, you don't know where everything is. Where's the local restaurant? What's the best place in town to get gas? Where should I go? What's some fun things we can do? And so the hotels have what's called a concierge, right? It is not just for people, you know, like me. It isn't that kind of what CancerBridge is it's really that concierge service. As soon as you hear those words, we've got you. It is.
It is.
Did I say that kind of okay? I don't know.
You did. Yeah. I mean, I think the word we use more is it's an agnostic service, right? We don't have ties to one facility. You know, our goal, yes, we're based in Columbus, so we do have access to a lot of local resources. That's super helpful for all of our employees and employers and our partners. But with that being said, if we have a employee, for example, whose family member lives in Texas, right, and they recently received a diagnosis, well, they can call CancerBridge and we will help them facilitate within their area and help them get connected. It's more of a connection, a bridge, so to speak, right, with a local National Comprehensive Cancer Institute. And, you know, we use these fancy acronyms in healthcare and NCI, CCC, like, what does that mean? And basically that is the gold standard, right, for oncology. There's a lot that rolls into that designation. You have to be heavily focused in research. You have to offer clinical trials. You have to provide, so many different service lines and yada, 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 yada. This list goes on. And so there's not that many NCI comprehensive cancer centers across the country, to where there's one in every city. It just doesn't work that way. So our goal is to make sure that we get our customers and their employees connected with the person that fits them best. Because at the end of the day, it's really about your patient preference, right?
Right.
And so we need to make sure they have that resource and that connection for where they are. And that's what we do. We meet them there. So we like to say we bridge that gap.
Right.
To provide the service for where they are.
And I think, thankfully, personally, as my own house, we haven't been affected, I almost want to say yet, because I think statistically, and I'm not wishing that certainly, but I have to guess, and based on, and you and I had a very close friend that walked, was my age, same demographic as a family, same ages, all of it. And it was very, very difficult and hard. And I don't know if I'll ever get over it as his friend, let alone their family and all those things. So I have to imagine that it's almost like being on a boat and being pushed, because you didn't ask for it, you didn't dive into the water, being pushed into a sea or a large body of water, and then the boat pulling away. I have to imagine that this is probably what it may feel like is, where do I go? And it sounds like you all really are that lifeboat that comes alongside and says, okay, we can, hop in and we'll at least get you going on the right path. Again, I'm really bad at analogies, but I think does that make sense?
Absolutely. And that's, that's number one, right? That's the initial call. What do I do? It's not even a matter of, is this the right treatment plan? Do I need a second opinion? It literally is, for some patients, I don't know how to process this information. What does it mean for me? What does this mean for my family? What does this mean for the future? And we focus heavily on that. A lot of our webinars that we offer to all of our employees and employers are focused on, just coping and grieving. In August, one of our topics, it's back to school season, but it's how do you tell the kids, right? Who knows how to have that conversation with their child for what a parent or a grandparent may be going through? It just doesn't come natural, We don't want to think about it. You probably don't want to talk about it. I think people might avoid it, but CancerBridge is here to help people guide them through this process and help answer anything from a basic question like, how do I wrap my brain around this, to, hey, can you help me find a treatment center in Texas, right?
Yeah.
And that's what we provide for them.
And I think you may have said this, but just to make sure that we cover it, this is a national network. This isn't just a Columbus thing or a Hilliard thing. This is a national footprint, correct?
It is, yes. We're based in Columbus, but we have one of our national clients that we have now. They have locations in Hawaii, and so we joke and say, yeah, we're going to have to go visit them.
Oh boy, yeah. Well, if you need some help, I'll volunteer to come along.
But it's really about us helping coordinate the care, and an employee calls in or a family member calls in. We have oncology nurses that answer the phone. So your first connection is with an oncology nurse. And then from there, we can have follow-up calls. We can help arrange calls with specialty physicians. We can help arrange things in different areas of the community in different states. So yes, we are a bridge that coordinates everything.
Yeah, it's an amazing service. Just based on the day that we talked on the phone, I knew right away this was something I really wanted to share. Is this for personal, or you mentioned employers a little bit? So do you work with companies and provide the service through the company, or is this for someone, let's just say me, God forbid, I get some bad news. Can I make that call myself, or do I have to go through my employer? How does that work?
Currently, it's more of a corporate platform, small business platform. We work with insurance payers, brokers. No business is too small or too large. It's a very low cost additional benefit that we offer. We are working on our strategic plan for next year, and an individual model. That question has come up. So that's something that I am definitely going to be looking into this next year. So maybe I'll have an update on that here soon.
Well, you're always welcome back if so.
Okay.
So
All right. Okay.
Well,
I'll be
can
just as nervous the second time around too.
I was gonna say, can I tell the story? Am I allowed to tell?
You can tell the story. Yeah.
All right. So everybody knows I do a little pregame, a little bit. We're unscripted, and I promise you there's no script, but there's always a little pregame, hey, it's gonna be fine, whatever. And Anna said that she's been in code situations as a nurse, and she's never been more nervous than she was for this. So you're doing fine, and I'm really proud of you. You're doing great. And so actually that transitions well. Welcome to Unscripted. And I want to come back to it, and we'll finalize. We'll get all the links and all that information. But tell your story. So how did you end up where you are today? Because I know you've spent a lot of time, as we just said, in code situations. You spent a lot of time in school. You mentioned acronyms. You have a lot behind your name, and I don't know what any of them mean. So tell us a little bit about you and your family.
Wow, I have a really long journey. So I guess it depends. At least we have an hour to talk about it, right?
That's right.
Depends on how far back we go. I mean, when I stepped out of high school, I had no clue what I wanted to do with my life. Who does, right?
Mm-hmm.
We're talking like 30 years ago. I can't believe it's been that long. But so I stepped into the entrepreneurial world, and I was a manicurist. And, my husband was working and I was working, and we were newly married. And from there, we started then a landscaping business. And so we both kind of had this entrepreneurial spirit, like, let's go, let's, conquer the world and be entrepreneurs. And eventually I just felt like, man, I kind of feel like I'm missing a little bit of my calling. Like there's something else I want to do. And it was either teaching or nursing. I just felt I had a passion for, one of those two fields. Mm-hmm. Stepped into the college space at 30 and pregnant with my third child. It was chaos. I survived undergrad. I got my BSN. And that was wild with 3 little boys at home. We had 3 little boys at the time.
3 boys too.
Yeah.
Boys.
And they're boys. I mean, they're the boys that are like flipping off the furniture when they're 3, And so that was probably one of the reasons why I switched from education to nursing, because I thought I'm going to have to learn how to save them one day.
Stitch something up, right?
Something. Yeah.
Exactly.
So yeah, I stepped into the healthcare space as a nurse, and my first job at Ohio, I worked at Ohio State as a bedside nurse, was on the corrections unit. And, everybody had said to me, oh my goodness, you work with inmates. Like, isn't that scary? Isn't that crazy? And I was like, it's kind of a little crazy. You learn a lot of things you probably don't want to learn, aren't exposed to throughout your life. But on the flip side of that, if you reframe that, the opportunity that I was given to impact so many individuals' lives and just caring for them.
Yeah.
That I will take that experience with me, in the 5 years I spent on that floor with me forever.
Wow.
Such a great experience. So from there, I kind of got reeled into leadership in healthcare, and I went back and got my first master's in nursing education because I thought I'd want to teach. But that line in the business management and operations and just was still in my heart. And I think it was just that entrepreneurial fire that I had years ago. Mm-hmm. So I ended up going back to school. I went to Fisher and I graduated from the MBA program in May. So that was amazing.
Wow.
And here we are, then this amazing opportunity came up for CancerBridge, and I networked with a peer and said, man, this kind of feels like a great fit for me. A big entrepreneurial component, right? With trying to make this business well-known in the community so people know the benefit it provides. All the while I get to be a nurse and still nurture and educate and be a part of people's lives from that perspective. So I call it my unicorn position.
Yeah.
That I think I was just meant to do. So here we are.
Well, and I think all that was important. And again, this is unscripted. I didn't know. I knew you had been through quite a bit in terms of your education. So now I'm nervous because I got a 13 on my ACT, and you're sitting over here with 2 masters. But anyway, so now I'm the guy that's really, really nervous. But
listen, I want to piggyback. I do want to interrupt you for a minute because I didn't bring this up, and I'm so thankful you did, because this is amazing that you said that. I didn't go to college out of high school because I got a 15 on my ACT. And I let that ACT score define me for years,
Mm-hmm.
right? I'm not smart enough. I'm not able enough. I'm not hardworking enough. Like, I can't pass this test, right? I allowed that test score to define me for so long. And so, to be honest, when I graduated from Fisher with my MBA, I thought, yeah, who cares what you got on that ACT? You can do what you want. You can impact lives. I've worked with inmates. I've held people's hands if they passed away. I've helped people navigate through cancer. You know, that ACT did not define me, right? So this is unscripted.
It is. It is. And that's what's so good is honestly, I know we're here to talk about a lot of things, but that's what I love about it, because you're right, and I joke often, and I've actually been told quite a bit lately, like, you need to stop being so self-deprecating, because I apparently I do it quite a bit, and it's just a habit. But I embrace my 13 on my ACT, because you know what, if I would have allowed that, as you said, to define me, then my life would have been a lot different, but I haven't. If anything, I've embraced it and used it as fuel. I did, not a plug, but did an episode recently with Gary Miracle from the Mercy Me video that everybody has seen for Say I Won't. And it's been a say I won't type attitude for me all the time. Say I won't, be better than my 13. So we're on a different path at the moment, but I'm proud of you. I know you've worked really hard, and I didn't know you got a 15 on your ACT. I had no clue. I'm really proud of you. That's unbelievable.
Thank you.
To look back at that and say, you know what, it doesn't define me. And if anything, it drove you. And you've raised 3 great boys in a business. I mean, you just mentioned a whole lot of things. Your resume is pretty strong for a 15 on the ACT, right? And I know often joke, and I probably shouldn't joke so much, but honestly, I embrace it. I embrace it. Just like being colorblind, I embrace it. I can't change it. It's what it is. So,
well, and what we learn from it, what we learn ourselves through the process, allowing something to control you or make you feel a certain way. We're not for that. We're not meant for that.
Yeah.
So we got to find a way to reframe it and think highly of ourselves and give yourself credit where credit is due, without being boastful or having an ego. But it's okay to be proud, hard work. And I have 3 degrees, right? But my older 2 boys chose to not go to college, and I'm okay with that. Everyone has to make the decision that they want for them. And my oldest son's an iron worker, loving it. He's in his 4th year of an apprenticeship program, loves his job. And it's such a huge, it's just the need for trades and skilled labor is so great. I'm so proud of him for stepping into that space and being willing to do that, building Columbus. So again, I think not everybody's path is, built on degrees. And there's a lot of amazing people that I know of that never even finished high school. So I've learned throughout the years to let that score go.
Well, and I love that. And that was completely a segment all of its own, unrelated to what we started with. But I'm thankful for that, because it really is powerful. And it means, and again, you've walked in through a lot of paths that the experiences that you've had, while some, it sounds like I can't imagine being next to people as they say goodbye or breathe their last here. But I think you said there's probably perspective in that as well, on a daily basis. And I don't remember, I think I might have asked you this on the phone, as a nurse, and I promise after this question, we will get back to what we were here to talk about.
That's okay.
As a nurse, how do you unpack, like, if I go to work and have a bad day, it's a bad day, you had a run-in with an employee, whatever it might be. As a nurse, you see things that most of us will never hopefully experience, and that's seeing someone breathe their last. As a nurse, how do you unpack that? And then how do you go home to 3 boys and your husband, knowing what you went through that day? And I think we talked about this on the phone, I can't remember, but how do you do that for anyone that's listening that may not have that perspective, or someone that's young in this field that maybe is starting to grasp, get that? How do you unpack or disassociate my day with what I have to go home and do that night?
Yeah. I think that's been an evolved journey. from the time I was a new nurse, and maybe because I stepped into the field later in life, I already had children at home, and it was just a little bit different perspective on the world. I would say for a young new grad nurse, find a mentor, find a nurse that's been a nurse for years and have those conversations. Unfortunately, a lot of nurses we have negative coping skills, right? I mean, we're so fatigued from taking care of patients, and we just put aside what's going on. When we talked earlier about a code, and yes, you're there for a patient, but at the end of the day, somebody's heart just stopped, and we have a job to do. We're trying to save their life. Every nurse across the nation goes through this, right? And we almost can compartmentalize it to some extent, or we get a little desensitized, because when that event is over, then we're like, okay, I go take care of 3 other patients. It's literally like a switch that you just learn to switch, right? And I'm not saying that being desensitized is a good thing, right? But I think everyone develops their own coping skills throughout the time. If you're a faith-based person, obviously there's a lot of faith and prayer involved. You may be a workout junkie that works out like crazy. There's negative coping skills as well if you're drinking or whatnot. I mean, everybody kind of chooses a little bit of a different lane. I love to travel. I love to spend time with my family. For me, that is how I unplug. I have a very supportive husband, that's just been 27 years this year. That's just from the great. Awesome. Yeah. So I think you just have to define and figure out who your support network is, because you're going to need it, especially the first time you lose a patient or you lose a close family member to cancer that you just had no clue was coming. I mean, I think about Pastor Mark all the time, and I've been a nurse for 12 years now, right? And that one hits me hard. I had a really good friend that passed away to ovarian cancer about 7 years ago. That one still punches me in the gut. You just our friend that we have, like for Steph, you just go through these seasons of life where you're like, man, how did this happen and why? And cancer doesn't discriminate. And as human beings and as a nurse, you just have to learn how to cope with that. And talking and having the conversation is the first place you start.
Yeah.
So I highly recommend a mentor, especially for a new nurse. Get connected, have those conversations, share your heart with them, and learn to grow through it.
That's awesome information. And it brings us back to, again, CancerBridge. Because I think for me, as I said, we've mentioned our friend Steph now a few times. I don't know that I'll ever get over that. And I was just his friend, and I'm blessed to say I was his friend for the time that I was his friend. But family, those around someone that has cancer, it's almost equally. I don't even like to say this, because there's the battle, and then there's the support system. There's the people that are in the battle but not in the battle, if that makes I don't know if that makes any sense, but I think there's a lot of residual that comes with it. I don't know if that's even the right word, but I think there's a lot that comes with it on the other side of it too. And it sounds like that's really a lot of what you all provide too for those those answers. Because the last thing I want, if let's just say a family member finds out they have cancer, the last thing I want to do is have to worry about and start Googling all these things that I just don't know. Like, I just want to worry about the person, not all of these things. And again, I want to bring it back to, isn't that what you all do? And that's what you really help the families provide is, hey, we got this. You focus on that. Is that fair?
That's fair. And we really help get connected, get them connected with, whether it's a family support group. I love that word that you said, residual, because, it's, as a family member or a close friend, you kind of feel helpless, right? You can drive somebody to an appointment, you can cook them dinner, you can donate financially, you can help cover all kinds of needs, but you can't get rid of the cancer. You can't have them suffering through some side effects, right? So I think that that's probably the most hurtful or hard thing for somebody who's not the patient to navigate through, and supporting the patient, right?
Yeah.
And so absolutely, we help families and patients get navigated and connected as best as we can in an environment close to them, so they can get the services and support that they need during the time. Yeah.
It's awesome. And because I think too, as you were talking, I was thinking too, I think for the person that is the one that's going through the struggle, the last thing that I need to worry about would be my wife worrying about, or my spouse, my kids worrying about, like, that would, I think, make it even harder.
Yeah.
Because and I'm just putting myself in the place of it. And again, watching our friend, as the provider protector, my concern is for my family. And oh, by the way, I'm battling this thing over here. And to know that my family is taken care of, that they're going to be fine. And I can focus on what I really need to focus on. That's awesome. It's really awesome.
Yeah.
What are the ways, for anyone listening to this, what are the ways that we can help?
As far as helping with CancerBridge, or helping with a family member who's sick, or I guess what angle?
All of the above.
Well, we have an amazing website, mycancerbridge.com, that you can go check out. Tons of resources on whether it's if you're an employee of a partner of one of ours, or an employer that's interested in CancerBridge. CancerBridge is not just a reactive service, right? It's not just a, hey, you have cancer, let us help guide you through this, right? It's also a proactive preventative service. So our wellness platform is amazing. We do mobile education events. So we try to educate on the impact and the power of food with oncology and health. Our most recent one we did was soy and garlic, and we have some chefs that will cook these amazing creations and talk about soy and garlic. And soy comes up as a conversation. Is it okay? Does it cause cancer? Does it not cause cancer? Too much of it? Not okay? Okay. To your point, if you Google it, one day we can have butter and the other day we can't have butter.
Right.
So we really focus in on grabbing the professionals in the nutrition space and either debunking a myth or saying, hey, do this in moderation. Let us show you how to prep it and cook it, right?
Love it.
That's our nutrition focus. And then we tie in another learning event every month, a webinar, and it's seasonal. So we just finished for this past month the ABCDs and E's of melanoma. So how to check your skin, right? What to look for. What do you do if you find a spot? Do you have a dermatologist that you need help navigating to that to figure out who to contact? So we do a lot of educational offerings. October is Breast Cancer Awareness Month, so we focus heavy on that. I shared with you in August, we're going to do a series on how to tell the kids, and you may not, as a subscriber of CancerBridge, have an impact, be affected by, cancer with having to tell a child, but you might know somebody that does. And so I think just for us, getting those resources out there for the public to know that we're there and that we have some really great resources for them, I think is, it's powerful. It's community. It's taking care of your own backyard, and making sure everyone is educated and updated on a lot of things, cancer and prevention. And I think a lot that I've learned as well through coming out of COVID and being in healthcare, and some things that make me a little nervous for the future is so many people were afraid to leave their homes. So many people were afraid to go see the doctor. And, we saw a decline in referrals to some of these, our oncology providers and whatnot. And so, I'm not really worried about a third COVID surge. I'm more worried about a, very sick population surge, because, second to cardiac disease, cancer is the second. I mean, it's the second leading cause of death in the United States. And there are hundreds and hundreds of different cancers. It varies among each individual. And so getting those preventative screenings, getting those colonoscopies, and talking about those tests that people think are so terrible, you just have to do it. You have to just put your foot forward, go see your doctor, take part in preventative wellness. And that's when people have more successful outcomes. Diagnosis is the key. So if I can do anything today, it would honestly just let the public that's listening know the importance of going to see your doctor, getting a checkup, and getting those screenings that are recommended. So important.
And I'll piggyback off of that without going into a lot of detail, but I did get one of those screenings that you have to get when you're of a certain age, which everybody probably knows what it is now. And there's, everybody talks about how the prep is worth the thing and blah, blah, blah. Anyway, but no, I mean, for me, thankfully they did find, something early, and hopefully, we're good to go. But what if I wouldn't have, to your point, what if I wouldn't have? And I do agree with you. I worry about the wake of all the people that didn't go because we were told not to go, or we were scared to go, or whatever it might be. Get in and get it done, because as our good friend said, you got people counting on you. And so if you're hearing this, go get your screenings done. Take care of yourself, because there's two things he told me once, and the other one I won't share right now, but the other one was, he said, you got people counting on you. And I carry that with me a lot, because we have people counting on us. It's not about us, right? So okay, so just to clarify, if I hear this and I'm an individual, do I go to my HR department and say, hey, I want you guys to check this out, or are you aware of this? Because it sounds like maybe next year it'll be, or you all are going to do some strategy stuff. So for now, as an individual, this isn't really something I can subscribe to myself. It needs to go through my company. Am I saying that okay?
Yeah, it's more of an employer benefit. It doesn't have to be wrapped up under a payer. So, sometimes your large insurance companies are your payers.
Okay.
We work with brokers the broker is kind of the middleman between a company and a payer. We work directly with businesses. We have over 25 clients. Some are local, some are national. And some of them, we work directly with them. And they said, hey, I want to offer this to my employees. Tell me about it. And we do. We can get them set up and launched pretty quickly.
So the bottom line is, if anybody's interested in this, heard this, go to the website. Now, the seminars that you talked about, is that individuals, or is that also through my company?
Is the what?
The things you talked about, like what you're going to do in August with how do you talk to the kids. Is that something I can do as an individual, or do I also have to do that through the same portal?
Yeah, currently it's ran through like an employer service, not individual yet, but that's something that we're definitely looking into, because we're starting to see the need for it, right? When Jeremy, my husband, and I were solely self-employed and we had to pay for our own health insurance, we had a lot of difficult decisions to make. Do you just keep major medical? Do you pay for full coverage? There was a lot of decisions to make. So having a benefit like this, that's, like I said, it's very affordable. It's a very low cost benefit. As a resource, it's impactful for people, for individuals, as well as big companies. So we're working on that. I see the need for that.
For sure. It's such a great service. It really is. I mean, I'm really inspired by what y'all do. So the important thing is, if you're an owner of a business, or have a small business or a large business, or you're connected with your HR department, I think that's probably the best way we can, as far as CancerBridge help, is go talk to them, give them the link, not a plug for the podcast, but give them the link to the website. And then if they want to know more, they can go to the podcast. But at the end of the day, go share the information, because that's really what we talked about. It would help you and help, share what the service that I think is so needed for everyone. So it's awesome.
It is. Yeah. There's a link in there, and you can just do a informational, and put your information, and it comes to our entire team. So someone will get back with an inquiry pretty quickly.
Awesome. So what's next for the Buehl family?
We are going to spend some time at the lake this summer.
Nice.
I'm definitely excited for that. I think it was an interesting year. I'm sure everybody can attest to that, right? And it was really interesting I shared this actually at a team meeting we had about a month ago, but it's really interesting to see everybody's perspectives, right? Like this last year, so many people were stuck in their houses, right? And a lot of people had this mentality, I can't go anywhere, I can't do anything, I can't get on an airplane, I can't, X, Y, and Z, put in whatever you want. And I was sitting at a meeting and I said, yes, a lot of things got put on pause, but let's reframe this for a minute. We had more family dinners
absolutely
at the dinner table this last year because my boys couldn't go out and terrorize the village or do whatever they do, Right. So, let's reframe that. Like if we didn't have, this storm of COVID hit us, we're still a close-knit family and we still try to have dinner together, but we never would have spent near as much time together as we have. How about you? Is that the same for you guys?
100%, 100%.
Yeah.
You know, and we
Yeah.
talked about, you know, and not to get too many, but yeah, I mean, everybody's, you know, they're at that age where they want to go off and they're getting ready to go off to college. So, you know, expenses are not, you know, what they used to be to allow us to go to OBX like we used to every year. And, but I was like, man, we spent 8 months together in the house, like playing games and cooking. And I, you know, learned how to cook more. And we, you know, we tried new things, and as evidence of this very platform and podcast. So yeah, you know, you're right. It is perspective, and it, you know, it's been rough on a lot of people. And, but yeah, no, I agree.
Yeah. And they've been a huge support network for me. You know, when I look back at the last year and a half, I was in grad school, right? Again, a very tough program at Fisher, running a business with my husband as I'm a clinical nurse leader, right? I mean, I didn't stop. I was essential. I was working every day. Oh, and guess what? There's a pandemic.
Right. Oh, by the way, let me just go ahead and throw the pandemic part in.
Yeah. So, you know, it was just like chaos. And I'm like, man, just to know that I can smile and laugh and have a sense of humor about it, and to have survived it all, you know, right. It's really has been a blessing, you know, to some extent. My heart breaks for the people that have had so much loss, you know, during this season, you know, but I think there's so much power in reframing our minds and thinking the positive, you know, and kind of to pull back to CancerBridge, if we think of the prevention and the wellness and the early intervention, same thing, right? There's tons of power in that. And that helps you remain healthy, right? And let's be proactive instead of reactive. Like that screening done, find something when it's small, so and you're not in the reactive stage and really fighting for your life with something that probably could have been addressed way earlier.
Yeah. And the fear of the test is not nearly as bad as the fear of what potentially could evolve if you don't get the test. I think is, you know, how you have to look at that. And I'm a guy that's scared to death to go to the doctor. I have white coat syndrome really bad. So, anyway, so something this has been awesome. This is see, you did fine. You did fine.
I did fine. See, I was so worried. You would have thought I was the one that going in for a test today.
Seriously, I mean, you know, I love that you shared that before we started to record. I love that you shared that you got a 15 on your ACT. I mean, that's so stinking impressive. With all that you've accomplished in your life and your career and your home and your family. That's awesome. That's awesome. Thank you for sharing that. Honestly, and we did not practice that. I promise. That wasn't scripted. So,
you know, there's days I think about that. I'm like, I have a story to tell and I don't know how to tell that story yet. You know, like, I think there's so many people that need to hear that. I think there's so many people that let a test define them. And, you know, so someday I'll probably have a long story to tell with this really impactful thing. I don't know, maybe I'll do a TED talk or something someday.
It's awesome. Yeah. Well, if you don't, you're always welcome back. Always welcome back. And now you've been through it. Now
I'll be good to go.
Didn't even know you were nervous, but all right. So mycancerbridge.com, right? Isn't that the website? Mycancerbridge.com. Go talk to your HR. If you own a business, is there a personal contact for you, or is it just best to go through the website?
No, you can reach out to me too. It's A. Buehl, and my last name is Buehl at mycancerbridge.com. So yeah, feel free to reach out to me or the website.
All right. So any questions, email, LinkedIn. And it'll all be in the post. But
yes, perfect. Yeah, that's awesome.
Thank you so much, Anna. This was wonderful.
Thank you for having me. You were awesome.
Well, tell the family I said hello. Tell Jeremy I said hello, and enjoy your time on the lake. You've earned it, my friend. You have earned it.
Thanks. Thank you. It's been a joy.
All right. We'll talk soon.
All right. Bye-bye.